A recent study suggests a correlation between near-death experiences and brain activity occurring after death. According to a report from investigators in the journal Resuscitation, patients who were resuscitated by cardiopulmonary resuscitation, CPR, had vivid memories of death up to an hour after their heart stopped beating. Additionally, brain patterns related to memory and thought were present while they were unconscious. Researchers at NYU Grossman School of Medicine, in collaboration with 25 primarily American and British hospitals, conducted a study where a few individuals who had survived cardiac arrest reported experiencing clear and lucid near-death episodes while they were seemingly unconscious. Despite the prompt administration of medical attention, only a small percentage of the 567 patients who received CPR while in the hospital were able to recover enough to be discharged. However, 4 in 10 of the survivors reported some level of awareness during CPR that was not detected by conventional methods. During the study, researchers discovered that a particular group of patients who underwent brain monitoring exhibited a remarkable result. Almost 40% of these patients experienced a return to normal or near normal brain activity from a state of flatline, even up to an hour during CPR. The brain activity was measured through EEG, which employs electrodes to record it. The patients registered an increase in the levels of gamma, delta, theta, alpha, and beta waves, which are linked to higher cognitive functioning. According to the authors of the study, survivors have frequently reported having heightened awareness and vivid, lucid experiences. These experiences often involve a sense of detachment from the body, the ability to observe events without feeling any pain or distress, and a profound evaluation of their actions and relationships. The recent study has discovered that these death-related experiences are unique and distinct from hallucinations, delusions, illusions, dreams, or consciousness induced through CPR. The authors of the study propose a hypothesis that suggests that the brain, in its dying state, eliminates its natural braking systems, resulting in a state of flatline. This process, referred to as disinhibition, could lead to the exposure of previously unknown realities, including the lucid recall of all memories spanning from early childhood to the point of death, viewed through the lens of morality. Although the evolutionary purpose of this phenomenon remains unknown, it provides an opportunity for systematic exploration into the end-of-life experience. According to Sam Parnia, Maryland, PhD, the lead researcher of the study, who is also an associate professor in the Department of Medicine at NYU Langone Health and holds the position of Director of Critical Care and Resuscitation Research at NYU Langone, conventional medical knowledge has suggested that the brain incurs irreversible damage roughly 10 minutes after the cessation of oxygen supply from the heart. However, our research has discovered that the brain's electrical activity can demonstrate signs of resuscitation, even during ongoing cardiopulmonary resuscitation, CPR. This study is the first of its kind to provide evidence that the brain's electrical recovery and the memory of near-death experiences may be universal collective occurrences. According to Dr. Parnia, the experiences that individuals undergo during death offer a glimpse into a little comprehended aspect of human consciousness. The implications of these findings extend beyond this, as they could potentially lead to the development of innovative methods to revive the heart or prevent brain damage, and could even have implications for the field of organ transplantation. The Awareness During Resuscitation, AWARE-2 study, which tracked 567 male and female patients who experienced cardiac arrest while hospitalized from May 2017 to March 2020 in both the United States and United Kingdom, was conducted. The study only included patients who were in the hospital to ensure uniformity in the methods of cardiopulmonary resuscitation and resuscitation, as well as in the recording of brain activity. During CPR, a particular group of 85 patients underwent brain monitoring. To gain a deeper insight into themes related to the recollected perception of death, the study also analyzed the accounts of 126 cardiac arrest survivors from the community who reported having memories of the event. According to the study's authors, the current research has not definitively confirmed or refuted the validity or significance of patients' accounts and perceptions of awareness during the dying process. They argue that further scientific inquiry is necessary to investigate the details of these near-death experiences, including the identification of specific biomarkers for clinical consciousness as well as the long-term psychological impact of cardiac arrest resuscitation. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.